Hi, everyone. Thank you so much for joining us this morning. So I would like to introduce, we have two presenters with us today. We have Sarah Gritani and as well as Heather Armstrong. Heather is a certified dental assistant, level 2, CDA 2 with over 20 years experience. And she is currently working in the seniors treatment clinic at the Grand Erie Public Health and has a passion for health promotion and community education. Heather is a busy hockey and baseball mom to twin boys and loves reading and hiking with her dog and horses. And so Sarah is also a health promoter, and she has been working with Grand Erie Public Health since 2016. And she has worked with a number of program areas, with oral health being newest to her portfolio. But Sarah also loves running, knitting, and playing with her two boys, ages 6 and 2. So we're very happy to have them with us today. So take it away, Sarah and Heather.
Thank you, Courtney. And thank you, everybody, for having us today. We're very happy to be here. As Courtney mentioned, Heather here is truly an expert in this field. So as Darlene mentioned, Darlene or Linda mentioned, there's going to be some time for questions at the end. So I encourage you to take full advantage of that question period, because this is the person that you want answering those questions for you. In addition to working in the seniors treatment clinic, Heather has also taught the oral health component for PSWs who are in training in college. She's actually taught that class, and she's advocated for older adults, oral care, and long-term care homes. So she truly is very passionate about this. Before we start the presentation, I am just going to take the moment to let everybody know, in case you haven't seen it around in the past few months, Grand Erie Public Health was previously the Brant County Health Unit and the Haldeman Norfolk Health Unit. We have merged together to form one health unit called Grand Erie Public Health. However, all of our services have remained the same. So if you're feeling a little confused about that name, Heather and I are located in the Brantford office, which was formerly the Brant County Health Unit. So that's where we're talking to you from today. So I am going to turn it over for this component to Heather, and I'll hop on at the end just to talk briefly about some of the dental benefit programs that are available. But without further ado, here is Heather.
Hi, everybody. Thank you for pumping me up. I appreciate that. So thank you for having me to discuss our presentation. And Sarah's going to be my techie person and moving the presentation along for me. So first of all, when we talk about oral health, we want to talk about why is oral health important, especially with a senior population. The good news is adults are keeping their teeth so much longer than they used to. So I always like to say good oral health is ageless. It's never too late to improve upon your oral health, or it is ageless. So it's important because you want to keep brushing your teeth to prevent things like tooth decay, gum disease, or just even, like I tell my kids, brush your teeth. Nobody wants to smell your bad breath. And you want to do things and take care of them so that you don't have a lot of tooth loss. So, and good oral health is important because it can help in fighting infections. There is a systemic link to pneumonia. So, and we know now that with that associated risk with poor oral health, we really want to decrease the risk of pneumonia. And also, there's conditions like diabetes, heart disease, and cancer. You really, without having good oral health, you can increase your risk of gum disease. So again, a lot of conditions can be prevented. So, and not only that, it's the first thing that people see when you approach somebody is your smile. And a healthy mouth will let you, eat properly, speak, and just be more comfortable as it affects your sleep. Okay, so visiting the dentist. So, there are recommendations to visit your dentist every 6 to 12 months. And I guess that that is a guideline, and everybody's insurances or their financial ability can dictate that. That is I always say, have that discussion with your healthcare provider. I go every 12 months to visit my dentist. But then, I do things to ensure I'm brushing and flossing and that sort of thing. And why is it important to visit your dentist? Chances are, you've put in the years to look after your teeth. You've, had fillings or crowns or root canals. You've had treatments that, you still want to maintain your healthy mouth. So just because you have fillings and crowns, and that is considered a healthy mouth. So you want to visit your dentist so that they can check, the integrity of these things. So, so what else am I saying here? Sorry about that. And again, it's the first thing that people notice about you. But the one thing in particular for seniors is you're at risk for 2 types of cavities. What we predominantly see is risk of cavities around existing fillings. Like everything, the new, white fillings have a lifespan. So you just want to have a dentist check and make sure that everything's intact. The other thing is, and I'm guilty of this too, it's years of vigorous brushing. Get a little too excited about doing that. Is what happens is your gums recede a little bit, and then you get areas that, it's not covered by enamel where you get that sensitivity. So folks are more prone to getting what is called root cavities. So you want to have those visits where you can have treatments like fluoride to strengthen that area, and or maybe fillings along the gum line. What else would I like to say? So yeah, and not only just fillings, if you wear dentures, if you wear full dentures, partial dentures, you really want to ensure that those are fitting you well, because your face changes, life changes. Sometimes things can become worn or not fitting quite as well. So you want to ensure that you're having that proper fitting so that you're not getting ulcers or sore spots in your mouth as well. Not only that, like toothaches can really affect your life. It can affect your quality of life, your quality of sleep. Yeah. And what's the next one? Yeah. And and the other thing is, like, visit your dentist. That would include having your teeth cleaned, because what happens is plaque can harden, and only that can be removed by a dental hygienist. And the other thing is, I got so much to say. A part of a routine visit would be like an oral cancer screening. So they're going to be doing a real visual check and catching things early. Really important if you're smoking. Okay, and not only that, and I always teach this to my new moms, or if I'm doing work with new moms, is dental decay is an infectious disease that can actually be spread from person to person. So if you're kissing somebody, or if you're with your grandkids and you're kissing them, or you're sharing a spoon, the bacteria can be transferred. So you really want to ensure that you're being healthy, because it's systemic as well, and it can affect other parts of your body. Okay. So brushing your teeth, I think we were talking before this, what's different? Well, brushing your teeth has never changed. There's so many jingles or so many jangles. Ideally, you want to brush your teeth for 2 minutes, 2 times a day. Really important is that you use a soft toothbrush, just because you don't want to recede those gums and scrub. You're going to brush all the surfaces. What we find with certain populations is sometimes if you have conditions that affect your dexterity. So if you find like, oh my goodness, I have arthritis or other conditions that may not allow you to brush your teeth properly. The good thing is we have so many items out there available to help us do the job. So one of them that I always say is an electric toothbrush. Gets the job done quick and really thoroughly. Now you can spend, I think this one Some of them are $20 all the way up to $100. This one's kind of mid-range. They all do a good job. This one's like everybody asks me, what's better, rotating or the little adjunct, whatever you're comfortable with and whatever you think is getting the job done is the best toothbrush to use. So whatever. So with that, I find too, when I'm talking to folks, if it's an issue of arthritis and they can't grasp, it could be something as simple as putting a tennis ball on the end of a toothbrush, because maybe this grasp doesn't work, but this does, because it's not as tight and you can hold on. So that's a little trick that some folks use. If, you know, it's a financial barrier to get all these newfangled fancy toothbrushes. Also a bicycle handle, because the grip is wider. So it's different for everybody what maybe their dexterity issue might be. Also, and these are really cool. I wish I knew about these when my kids were really little because of the toothbrushing struggles I had. This is called, they're available on Amazon. It's called a surround toothbrush, and they make them for all ages, like so larger ones for like, you know, an adult. But what it does is when you brush the teeth, it brushes all your surfaces at one time. So I'm sorry, it's probably really hard to see, and I'm not really experienced with doing this on a computer, so bear with me. If you can see here, when I put the toothbrush on, it brushes all the surfaces at once. So the biting surface, the top, the inside and the outside. So again, if doing the circular motion or all these other things, and maybe it's hard or, you know, your hand gets sore, this is a really cool option. I'm pretty excited about these. And I think Sarah can, if anybody's interested, can pass along this information. So modifications like that can really go a long way in, and then people feeling like they can still do the job themselves. Also, I get a lot of questions maybe about toothpaste. So you're going to use just a pea-sized amount of toothpaste. You don't have to like use a ton. Some people really love having lots of toothpaste, but I like just using a wee bit because it's actually the like actual mechanical action of using the brush. It's actually the action of the brush that cleans, not actually the toothpaste, although toothpaste, and we'll get into this a little bit, containing fluoride does really help, you know, fight the cavities. And especially if you're having like some recession, you're going to want that higher level of toothpaste. So there's all different kinds. So I'm not picking one over the other because some people like different flavors. They may like, oh, I like Colgate, but they all have like a brand of toothpaste that has like a higher concentration of fluoride. And that really helps when, like I said, for just taking care of your teeth.
We'll do that one, or do you want to skip over?
No, I'll touch on this one.
Okay.
I know everybody, you know, knows how to brush their teeth. I always say, and there is a sequence that you could do it. I always just say, do whatever works for you. They always say start from the top. I personally always start from the bottom. I don't even know why, but you know, just make sure you're doing the outside, the inside, the biting surfaces. And again, just don't brush too hard because that's where your root surfaces might be able to show. And then you get what is called sensitivity. And I think everybody can at some point experiences that a little bit. So then again, that's where you can choose different toothpaste. The higher fluoride does help, but like sensitivity toothpaste. But that's where, fun fact, when they say, oh, they're long in the tooth, it's because the gums have actually receded and the tooth has become longer. So yeah, so that's kind of where that came from. And we all have a strong side that we brush. Like I tend to brush my right so much more than my left. I don't know why. So, you know, just being aware that there are areas that we, for some reason, tend to spend more time on. Flossing. So working in the clinic, the seniors clinic, flossing seems to be one of the things that nobody likes to do, quite honestly. I mean, it would be great if it says here to floss 2 times a day. I would say flossing before night would be ideal for sure. Only because it kind of cleans where the brush can't reach. So, and again, if you have arthritis or dexterity issues, and it's because I know how to work floss, it's a little bit easier, or just even for kids in general too. So the thing about floss is you can, and I see this, you can have healthy teeth, but it's the gums and the bone that hold the teeth in place. So you can have beautiful teeth, but you can still lose your teeth due to gum disease. So that being said, there are so many different items that you can use. So this is called, this is my favorite. It's super floss because there's areas like if you have crown or bridge, or like I have retainers from braces, there's like a little hard little end you can poke it through, and then the floss is actually fuzzy like a blanket, so it really cleans. But if dexterity is an issue with that, then you can also use your floss holders where you put, string floss. I mean, there's so many flosses on the market. You can kind of just choose. Some taste good, some are like have more puffiness to them. But if string floss isn't your thing, I mean, I'm presenting the gold standard here. A lot of people have success with these little interdental picks. If you have really tight spaces, I wouldn't be jamming these in my mouth, but they do remove the food. They have little massagers, so that's helpful. And there's, like I said, there's so many different products to do the same job. You can have little picks like this. These are kind of, I find, because the floss area is so small that I have to rinse them off, because like if I'm eating, I don't know, stuff that really gets in between the teeth, then you have little brushes that like a little tree on the end. If you go to the dentist, they can offer you these, and then also these, they don't get in between the teeth, but they help in crowded spaces. I would say water flosser. I would say majority of our clients prefer the water flosser, but again, there is a financial component to that. But it does a great job. I don't know the statistics. I can't remember the statistics on it. Actually, we had a person come in, but it really does remove a lot of debris and bacteria. So that's my spiel on floss. So another thing that so dry mouth, and the technical term for it is exteroma. And dry mouth, I like to say it's kind of like being thirsty times 100. So, and there's different degrees of dry mouth, but it can be painful, burning. It's hard to eat without saliva. So if you have a dry mouth, it like saliva aids in digestion, so it can affect that. Also, if you don't have a lot of saliva, it's hard to get suction if you're a denture wearer. It's common as we age, but it's not common for aging. It's not because of aging. It's more because of, medications, conditions that may contribute to having dry mouth. So, because saliva naturally bathes the teeth, and without having that saliva, then again, because you can be more prone to cavities. So the other thing, how you can be caused by medications, any kind of treatments you may be receiving. So I have some products here that I wanted to show you. The number one thing, dry mouth protection, is we do have some products, because if you really have had dry mouth, it's really uncomfortable. So on the market, there's rinses, because if you have dry mouth, or even myself, I can't use like Listerine or anything. I find it very, very drying. So you can use a mouth rinse. You can get these at the Shoppers Drug Mart. That's moisturizing mouth rinse. For some folks, sipping water is a great way to prevent. But sometimes you need that little extra help. Biotine also makes what is like a spray. So you could spray it in your mouth. It lasts a couple hours. And it just, you know, if you've ever had dry mouth this really does the trick. For some people who aren't comfortable with sprays, there is also what is called a gel. So you can apply that on the gums. I know they do sell almost like a foamy toothette that you can apply them on. I would say if, you know, there's no risk of you, for yourself I just say if you're caring for an older parent or you're helping somebody with their oral health, I don't like those toothettes because if they bite down, they could, so I'm always like a no with that. So that's just a little thing, but there's this. The nice thing too is they also make a toothpaste. So with dry mouth, you don't want to use too of a foamy toothpaste because the toothpaste can actually contribute and burn your mouth. So you want to look for a non-foaming that contains no sodium lauryl sulfate, and that's what gives you all that bubbles. That's not what you would like for sure if you have dry mouth. So they do make a special one. But again, if you know, this is a little bit more expensive, another alternative would just to be to find one that's non-foaming and use a lot less. Okay. And so there's that. There is you're prone to like, always suck on a lozenge or a candy. Unfortunately, the sugar actually exacerbates that condition. So you want to look for lozenges that are maybe, you know, sugar-free. One thing too with dry mouth, if you have the dry inside your mouth, it actually then sometimes happens to the outside of your mouth. So you can get like the dry cracked lips. One of the recommendations is not to use any Vaseline, petroleum based products because it can actually clog the pores of your mouth and actually contribute to more drying. That was something I learned recently. So anyways, avoid caffeine or spicy foods. Again, if this is something you truly love, try limiting them, you know, and just avoid those mouth rinses that contain mouthwash. And also because you need saliva to digest your food and help, you know, rinse your mouth every time you eat because you don't have that saliva bathing and helping remove the food. So just rinse your mouth after eating. I think I'm getting dry mouth. I have a lot to say. Okay, so we've talked about, you know, taking care of your natural teeth. And now we're just going to talk about denture care. I feel like
That's the last one.
Yeah.
Yeah.
Okay. So we're going to talk about denture care. So there's so many different combinations of dentures. We have a denture clinic here. So you have some folks who have partial dentures, full on the top, or there's so many different combinations according to, you know, what teeth are missing or that sort of thing. So what the most important thing is you need to care for your dentures, partial or complete, the same way you would care for your natural teeth. You want to, you know, clean them, take them out and clean them with a brush. With a brush every day. They do make paste, specific paste for dentures. If that isn't something that you want to add to your budget, just use soap and water. We don't recommend that you use toothpaste because toothpaste is very abrasive and it can make little tiny scratches in your dentures, which then harbors more bacteria. So you want to ensure that you're not doing that. When you're cleaning your dentures, you want to just line the sink with a towel and, you know, firmly, but not too hard with 2 fingers, just hold them so you don't break them. So again, yeah, so never use a toothpaste, always use soap or a denture paste to clean them. Don't use hot water. I mean, I'm like that too. Whenever I'm washing something, I'm like, oh, hot water is going to get it. You don't want to do that. You can actually warp your dentures. So you really want to clean them and it'll help reduce the fungal infections that you can get from a denture. And a lot of times, and this surprises me, but the recommendation is you take out your dentures at night and you put them in a cup with like water, or you put them in with like a cleaning tab. I would say, I'd say over 50% of our clients were like, I never remove my dentures at night. So it's really important because it allows the tissues in your mouth to breathe and rejuvenate. Like your tissues need to slough off like the old skin cells. And also if you're using kind of adhesives to help those dentures stay in, you really want to clean that off so that everything's a little bit healthy. And then 2 times a week, you want to clean the storage cup so that it doesn't become like black or slimy. Yeah. Okay. I think that's all I have. I'm sure everybody will have questions, but I'm so.
I'm gonna come back here. So before we get into the question period, for Heather, I'm just going to do a brief overview of some of the publicly funded dental programs. I'm not going to spend too long because I understand you have had a previous presentation from the CRA on the Canadian Dental Care Plan. That's how you apply, and that's who the plan is administered through. But I will give a brief overview, just a reminder of that plan. And also, so that's a federal plan, and then also our provincial plan, which is the Ontario Seniors Dental Care Plan. So the Canadian, sorry, I just got to move our little window here so I can see my points. The Canadian Dental Care Plan is for folks who do not have access to dental care. So that means if you have any sort of dental coverage through retirement benefits, through working benefits, through family members, you don't qualify for this program. It requires that you and your spouse or common law partner have filed your tax return in the previous year in Canada. The net family income has to be less than $90,000 and you are a Canadian resident for tax purposes. And so right now, applications are open for everyone over 65 and under 18, and those with a disability tax credit. And actually applications just opened up for everybody as of May 1st. And if not May 1st, I believe it's May 25th. So this month means that everybody in Canada who fulfills those criteria can now apply for this program. The nice thing about this program, I've heard overall pretty good feedback when I'm talking to members of the community. The nice thing about this program is the income threshold is higher. A lot of the dental programs that we have available for public funding are, the income threshold is when I say higher, I mean the income requirements are lower. So this allows a lot more people to qualify for dental care assistance. And it also covers preventative services. A lot of our publicly funded programs cover emergency services. So this one's really great because it allows, like, you know, visiting the dentist and those things that Heather was talking to you about before. From what I understand, a lot more dentists are opting into providing this plan. It is something that they have to decide to opt into. Initially, I think there weren't as many dentists, but as I've been speaking to members of the community, it sounds like a lot more dental providers have been opting into that program. Do you have anything to add on this program?
No, I would agree. I feel like a lot of dentists are on board. The fee guide is a really good fee guide. Yeah, I've known several family members who've had great success and have received amazing treatment.
The degree of or the amount of coverage you get is dependent. If you're less than that $90,000 within that range, there is I believe an income under $70,000 gives you like 90% or 100% coverage, whereas above that you may have a copayment. But in general, that copayment is just significantly less than what you would have been paying before out of pocket. Anything else on that one?
I don't think so.
And then the Ontario Seniors Dental Care Plan. So this is the clinic essentially that we provide through the health unit. So whereas the CDCP we just talked about is provided through dental through doctors' offices, This is the program that we administer and we provide care for at the health unit, and that Heather works directly with. So this is free routine dental care for people who are over 65. The criteria is that you are 65 and older, a resident of Ontario. It can be combined with CDCEP
Yes.
benefits. You also, again, filed your taxes in the previous year. The annual net income requirements, though, is an income less than $25,000 for a single person per year, or $41,500 per year for partners. But if you do qualify for this, you can actually get in touch with us directly. We have our contact information just on the next slide here. You can get in touch with us, and we can easily sign you up for that program. We don't have much of a waiting list right now, which is great.
No, we've caught up. I think when the program first came out, we had a backlog and a big wait list, but we've really done a lot of work.
Yeah.
Really have done a lot of work. And we do have quite a few seniors who do have both coverages, because the Ontario program, the federal program offers a few more, I don't know, bells and whistles.
Yes.
So we do. And then we have some folks that just love coming to us. So that's amazing.
Why wouldn't they?
That's right.
So this is going to conclude the sort of official recorded part of our presentation with our slides. I've included our email and our phone number, but I am going to be following up. I will make sure that Linda has that information so that she can send that out in the follow-up email. We also included in that email a link to both information on both the Canadian Dental Care Plan and the Ontario Seniors Dental Care Plan, as well as 2 PDFs. One is just general oral care for older adults, and one specifically relates to denture care. They come from the Canadian Dental Association and the Hygienists of Canada. So they're very reliable resources, and hopefully they're helpful to help you recall some of the information we talked about today. So that's it for us. Should I believe I'm meant to stop sharing my screen now. Is that correct?
Yes.
Okay.